Well, I would say the most interesting thing about robotics, patients when you have that discussion in the office with patients, they always think that some crazy robotic machine is going to be operating on them. There's not going to be a person involved, and that's not really the way that it works. We have two consoles to the robotic system. So one is called the patient cart, and we put in laparoscopic instruments just like you would for a gallbladder or laparoscopic hysterectomy or tubal ligation. We put those ports in, and then those are attached to the patient cart or the robot. And then we actually sit at a console and control every movement of the robot. And if you step away from the console, it freezes where it's at. It's not moving without human control. The interesting thing is that console that we use, it's three-dimensional vision. So there's actually two lenses in the robotic laparoscope, and those left and right images are merged to make it three-dimensional, which is totally different than a two-dimensional TV screen that you get with traditional laparoscopy. So it's better visualization and better magnification. About 5 to 6 years ago, Baptist St. Anthony's Hospital here in Amarillo bought the Intuitive or Da Vinci robotic surgery system. And we started doing hysterectomies with that. We were the first case to go on that new system. We did the first hysterectomy with it. It's interesting is when we had, or 5 to 6 years ago when we started, about 80% of all hysterectomies were done abdominally. So a big incision, longer recovery time. Typically those patients would stay in the hospital 3 to 4 days, 6 to 8 weeks for full recovery, full activity, going back to work, those kind of things. Since the robot has been here, and there's also been a big push in town toward laparoscopic surgery and laparoscopic hysterectomy, I would say 90% of our patients now stay one night and go home the next day. As long as patients don't do like heavy physical labor as a career, a lot of them are back at work in 2 to 3 weeks, so minimal time off. And it's really helped patients. I think outcomes are better. I feel like we can do as good or a better operation than we could with a big incision, but with a whole lot less recovery time, and really good outcomes. We've done hundreds of procedures now as a group with really good outcomes and really low complication rate. The biggest incision about 12 millimeters, just a little over a centimeter, and that's for the camera. So they're all pretty small incisions. Yeah, you know, traditional open surgery patients would be on a PCA pump, which was IV morphine or strong narcotic medications where they would push a button up to every 6 minutes to control their pain. Most people now with laparoscopic and robotic hysterectomies, they may get a dose of morphine through their IV, and then most of them are on pain pills. And majority of people are tolerating a normal diet the day of surgery. They're up and around walking. We typically watch them overnight just to make sure they're not going to have bleeding or other issues with nausea or side effects from anesthesia. But the next day they're usually up and around ready to go home. And that's a big thing now. More women are professionals, and a lot of women now are the major breadwinners for families. It's hard to keep them out for 6 to 8 weeks, so going back to work in a couple weeks is a huge benefit. People sometimes ask, why use the robot? You know, what's the benefit? And again, I think it's more precise surgery. We can do a comparable operation to an open incision operation, but with minimal pain, small incisions. The other thing that doesn't get talked about a lot is when you do robotic surgery, you're sitting at a console, and ergonomically it's perfectly comfortable for the physician, so there's no fatigue. And the robotic machine actually gets rid of any shake or artifact from our movements. So it's very, very smooth, it's very, very precise, and there's no fatigue. So a surgeon can do more operations without being tired and maybe increasing complication rates from a physician that's been operating all day.